The Cedars-Sinai Biomedical Imaging Research Institute was established about 5 years ago. Our mission is to develop and apply novel imaging technologies to solve important clinical questions such as cardiovascular disease, cancer, and neurological disorders. In addition, we educate and train students and clinical fellows to become future leaders in biomedical imaging research. We have developed a fast, accurate, reliable, and comprehensive MR examination of the coronary artery disease that we believe can lead to improved prevention, diagnosis, and treatment of coronary artery disease.
Exciting work is being conducted at Cedars-Sinai and the Biomedical Imaging Research Institute. Coronary artery disease is one of the most common causes of death in both men and women. We have very effective treatments for coronary artery disease. Cardiac imaging has the potential of allowing us to personalize the delivery of medical care. Cardiac MRI provides a comprehensive assessment of the heart. It's been shown that it gives a very accurate assessment of heart muscle blood flow at rest and stress. More recently, it's been shown to be able to look at coronary stenosis or even at the characteristics of coronary plaques.
Detecting coronary artery disease and the plaques along the coronary wall is a very challenging task because of the motion of the heart, the need for high spatial resolution, the need for high tissue contrast, and the long imaging time. We have overcome these challenges by developing novel techniques based on imaging physics, image formation theories, and demonstrated that we can accurately detect significant coronary disease in patients of the entire heart within 5 minutes.
The major causes of ischemic heart disease are those traditional risk factors, but there are also novel risk factors, and we're studying those as well using the advanced imaging to unlock new treatment targets so that we can do a better job treating heart disease and also preventing it. These advanced imaging techniques can detect a problem that is the source of symptoms or heart attacks that other techniques were not able to detect. So all of a sudden you have an answer to the puzzle or to the mystery. So many of these advanced techniques do not use the ionizing radiation. The radiation that we know is cumulative and can contribute to things like cancer and other organ problems.
Current conventional methods in terms of quantifying the subendocardial flow are lacking in accuracy and in reliability. What we do here at Cedars-Sinai Biomedical Imaging Research Institute is we're developing new methods that achieve unprecedented accuracy and reliability in quantifying flow in the subendocardial layer. And one of our main goals is to tackle this problem of reliable and accurate diagnosis of coronary microvascular dysfunction, which is a very new and exciting area in non-invasive cardiology.
Characterizing the heart tissue before and after a heart attack is important because it can determine specific and optimal therapeutic options that are available to the patient. The future of cardiac MRI, I think, would greatly benefit from the use of non-contrast imaging methods because, one, it first of all opens the door for imaging pretty much everybody. Second, you don't have the cost associated with contrast agents. Also, it makes exams faster. You can do serial exams, and it becomes cost effective.
So the good thing about this is we have also applied our novel imaging methods to other medical problems, such as evaluating the heart muscle condition after heart transplantation in collaboration with the heart transplant program here at Cedars-Sinai.
We are actually the largest heart transplant program in the world. Last year in 2014, we did 122 adult heart transplant surgeries. Currently, we have no reliable techniques to diagnose myocardial fibrosis. One of the big problems in heart transplantation is about 1/3 of the patients develop kidney dysfunction. And because of that, we cannot use the usual technique of MRI and gadolinium enhancement.
we developed a novel diffusion-weighted imaging technique to detect myocardial fibrosis, which has the potential to predict chronic rejection of the heart transplant without the need of contrast media. And we utilize a special motion compensation approach to eliminate the effect of motion on the MR signal.
We now have this diffusion MRI scanner. We can now look at myocardial inflammation, possible ongoing rejection, and it allows us to detect myocardial fibrosis, and in those cases, we go directly to retransplantation.
At the Cedars-Sinai Biomedical Imaging Research Institute, we have a strong multidisciplinary research team who share a common interest and are passionate about working together to address some important clinical questions.
Dr. Debbie Ali has put together a group of 40 to 50 young, talented, enthusiastic, brilliant scientists studying some of the most important questions in cardiac imaging.